Good afternoon. The case I share with you is HIFU combination therapy with Lauromacrogol injection in the treatment of cervical myoma. And as you can see the case of this patient, so largely in pregnancy and with the hard tumor. And gynecological examination showed the position and the posterior lip of the cervix and was probably near the isthmus, and the size of the tumor was about 4 centimeters. And this is the image under the ultrasound. And under enhanced MRI, the TR low signal intensity and homogeneous texture and right posterior rectum. And this is the enhanced MRI, indicates the enhance of the signal. And so the analysis of this patient, young woman, and with the requirement for fertility, and her cervical myoma is 4 centimeters. So we work out the treatment plan for this patient. We had a discussion because of its special location of this myoma. So if we use the laparoscopic surgery, and because of the low position of the myoma, so there will be the risk of bleeding. With the HIFU treatment, so and the location of this myoma may cause some nervous system damage and also cause some discomfort or pain of this patient and influence the process of our treatment. So finally, we decide to combine HIFU treatment and injection of LMG. So before the intervention, we had this angiography. And the internal part of the myoma, using this intervention treatment, so the second day of the injection, we give him the HIFU treatment. So before HIFU treatment, we had this angiography and a little bit reduction of the blood supply. And in 290 seconds, we can see there was a very obvious and the distribution and at the lower part of his body. So intraoperative angiography was considered to be safe, and it suggested the most of the ablation was performed, and there was a little residue at the edge of the section. So 15 minutes of the rest, we continue the treatment with 400 seconds of treatment. So the treatment of cervical myoma by HIFU is difficult and risky. So LMG is a new form of treatment, and it can cause septic inflammation around the blood vessel or fibroids and reduce the blood supply of fibroids when injected into the central part of the fibroids. And at the same time, this injection is an ether compound which can effectively alleviate the pain of the local lesions after operation and improve their tolerance. And we're looking forward to some more data to support our hypothesis and expand the indications.